The United States, a land of innovation, has always had a complicated relationship with healthcare. Unlike many developed nations, the US did not establish universal healthcare in the 20th century.
The Great Depression, however, made it clear that many Americans needed help affording medical care. In 1935, President Franklin D. Roosevelt signed the Social Security Act. This act provided a safety net for vulnerable populations like the elderly and the poor. It was a significant step, but it didn't cover everyone.
It wasn't until 1965 that Medicare and Medicaid were established. Medicare offered health insurance to seniors over 65. Medicaid provided coverage for low-income individuals and families. These programs were crucial, but they still left millions of Americans without health insurance. The US healthcare system, from its inception, has been a work in progress, constantly evolving to meet the needs of its people. Today, the US healthcare system is a complex mix of public and private insurance. Most Americans receive health insurance through their employers. This is known as employer-sponsored insurance.
Others purchase insurance individually or through government-run marketplaces like the Affordable Care Act exchanges. Medicare and Medicaid remain vital safety nets. They cover a significant portion of the population, including the elderly, disabled, and low-income families. However, millions of Americans are still uninsured or underinsured.
This patchwork system creates challenges. It leads to administrative complexities and inconsistencies in coverage. The uninsured often face financial hardship when they need medical care. They may delay seeking treatment, leading to more severe health problems down the line. The United States spends more on healthcare than any other developed country. Yet, health outcomes for Americans are not always better. One reason for this is the high cost of care.
Several factors contribute to this, including administrative costs and pharmaceutical prices. Administrative costs in the US healthcare system are staggering. The complex billing processes and multiple insurance plans require a vast administrative network. This bureaucracy adds to the overall cost of healthcare without necessarily improving patient care.
Pharmaceutical prices are also a major driver of healthcare costs. The US government does not negotiate drug prices with pharmaceutical companies as many other countries do. This lack of negotiation power results in higher drug prices for American consumers. Section 4. Unequal access, healthcare disparities in America. Access to quality healthcare is not equal in the United States. Where you live and how much money you make can significantly impact your access to care.
People living in rural areas often face a shortage of healthcare providers and facilities. Long distances and limited transportation options can be major barriers to accessing care. Rural hospitals also struggle financially, leading to closures and reduced services. This disparity further exacerbates the challenges for rural communities.
Socioeconomic status also plays a significant role in healthcare access. People with lower incomes are more likely to be uninsured or underinsured. They may struggle to afford high deductibles and co-payments. This can lead to delayed or foregone care, resulting in poorer health outcomes. Section 5. Bridging the gap. Innovations in healthcare delivery. Despite the challenges, there are innovative solutions emerging to improve healthcare access and quality.
Telehealth, for example, uses technology to connect patients with healthcare providers remotely. This is particularly beneficial for people in rural areas who may not have easy access to specialists. Community health centers are another vital resource, providing comprehensive care to underserved populations. These centers offer a range of services, including primary care, dental care, and mental health services. They focus on providing affordable and culturally competent care.
Other innovations include value-based care models that prioritize patient outcomes over the number of services provided. These models aim to improve care coordination and reduce unnecessary costs, ultimately leading to a more efficient and effective healthcare system. Section 6. The future of US healthcare. A call for change. The US healthcare system is at a crossroads. While it offers advanced medical technology and treatments, it struggles with high costs, unequal access, and administrative complexities.
Addressing these challenges requires a multifaceted approach. Policymakers, healthcare providers, and citizens must work together to find solutions. This includes expanding insurance coverage, controlling costs, addressing social determinants of health, and promoting innovation.
The goal should be a healthcare system that is affordable, accessible, and equitable for all Americans. Achieving this vision requires a commitment to continuous improvement and a willingness to embrace new ideas and approaches.
The future of U.S. healthcare depends on our collective action and dedication to building a healthier nation.